The Rio Grande Valley, Texas, 1990 population 450,000. 2012 population 1.4 million and growing. For decades, South Texas lacked critical access to healthcare services. With the dynamic growth of the region, there was a mounting need for better healthcare. In 2003, local physicians came together to create a full-service general acute care hospital to meet that need.
We are a full acute care hospital that's open 365 days of the year. This grew out of our desire to be the very best physicians we can be, where we try to remove those impediments that get in our way in other facilities. And it has to do with how it's managed. If our focus is patient care, then it makes sense to have more nurses, to build a facility that brings the latest and greatest in certain technologies and allows us to be able to keep our patients in our community. It makes me a better physician to be able to work in a facility that empowers those individuals on the healthcare team to help make the best decisions for their patients. And we do it over and over again here, and it's done every single day.
Doctors Hospital at Renaissance, a better healthcare model.
In the beginning, all of us used to work for other out-of-state corporations. And we quickly realized that physicians were never invited to the table.
Patients were denied the sophisticated services that were available elsewhere. Physicians were denied the means to treat the patients in the manner in which that they were trained to do so.
A particular instance that I remember very clearly that really made me decide this is not right is when, I had a patient come in with abdominal pain, and it took me 3 days to get a CAT scan and get that reading. There was a refusal, I think, of the administration at this other hospital to hire appropriate staff to be able to do that test.
At the same time that tens of millions of healthcare dollars were being taken from the community and shipped to out-of-state corporations.
When you see an example like that, you have to ask yourself, who really is benefiting from this healthcare? It sure wasn't the patient. It sure wasn't the physician.
Many patients still have to travel to MD Anderson in Houston, which is 350 or so miles away, or go to Dallas to get similar care, or to San Antonio, which is 240 miles away.
The Valley has always been, unfortunately, so isolated, both in terms of healthcare, in terms of economics.
We live in one of the poorest counties in the United States, and I think a lot of our patients do not get access to health care, perhaps until very late, in their lives.
A lot of physicians decided to leave the old paradigm of how to do medicine and create a hospital that our main interest would be our patients.
When I started in 2000, there were 5 employees. The organization employs almost 3,500 people, so we've rapidly grown over the years because of the needs of the community. We added the first North Tower inpatient unit was a 32-bed unit. We quickly proceeded to add an emergency room, cardiovascular services, and moved from there to provide women's health services. We are the only women's hospital in South Texas. We've recently added our behavioral hospital. We have a rehabilitation unit. We are a full-service facility.
Doctors Hospital Renaissance represents a unique model of medicine where physician leadership, the latest medical technology, and a keen understanding for the community are paramount to delivering world-class healthcare for South Texas. DHR is majority owned by the same doctors who treat patients every day. The hospital counts on over 600 practicing physicians, over 1,000 nurses on staff, 500 medical beds, a full-service 26-bed emergency room staffed 24 hours a day, offering over 50 medical subspecialties, and the highest nurse-to-patient ratio in South Texas.
Because of the high nurse-to-patient ratio that we have, it allows for the staff to be able to take a lot of time with the patient.
If you have 12 patients, it's really hard to know all of them, and you have 6, that's a lot easier.
You're going to get your nurse's aide, you're going to get competent nurses, and so because you have a complete team, it makes it so much easier on everybody. But number one, it makes it easier for the patient to get the quality care that they need.
DHR continues to serve the community with the newly opened Therapy Institute at Renaissance, our inpatient acute physical rehabilitation facility, the Joslin Diabetes Center, our diabetes community outreach and research center in partnership with Harvard University, and the Edinburgh Conference Center at Renaissance, a state-of-the-art conference space used to connect doctors worldwide with the Rio Grande Valley. In 2011, U.S. News & World Report ranked Doctors Hospital at Renaissance as one of the best regional hospitals in America and recognized it as high-achieving in 9 different medical specialties.
At Doctors Hospital Renaissance, I'm the Chief of Pediatrics there, so I attend those quarterly meetings. I'm also the Chief Medical Compliance Officer, so I attend that meeting every month. Whatever I decide to do or we decide to do as a governing board at Doctors Hospital, it will impact not only us personally, but it will impact everybody in our community. It's very, very personal.
That by far is one of the biggest credits to this hospital, is the significant physician involvement in decisions.
Who knows more about healthcare than physicians? Who knows more about what equipment to buy, the quality of nursing care, how best to take care of patients.
They're with us by the bedside with the nurse, to be able to know firsthand what their patients are experiencing and to take that information back to the boardroom or back to us as directors and to make those decisions that need to be changed immediately.
At one of our meetings, one of the primary care doctors stated how he had already had 2 patients fly to Minnesota to get this robotic prostate surgery, and then the pros for the patient: less blood loss, less time spent in the hospital, less complications. So we researched it, and sure enough, we had, within 6 weeks of that discussion, the Da Vinci machine was here.
If there's new technology that's not available here and the physician community wants it, we're committed to providing it.
I'm very proud to say that in the last 3 years, we've done more than 150 robotic surgeries here in the Valley. No longer these patients have to think that we have to go to MD Anderson, we have to go to CTRC or Cancer Therapy Research Center in San Antonio. San Antonio is coming to the Valley. When I do my surgeries here, I never feel that I'm not in the most optimal environment.
I've had the opportunity to practice coast to coast. I did my training at Harvard, at Boston Children's, I worked at UCLA. I've never worked in a hospital setting, particularly a private hospital, where if you go to administration and you go to the people who are willing to support you and you tell them that you need something and you explain to them why it's going to benefit the patient, why it's going to benefit the community, they do it every time.
I think that's extremely important that people know is we've reinvested every bit of the profits that have been earned here in expanding facilities and bringing in new technology.
The hospital has invested over $40 million to bring the electronic medical record system online. As part of the initiative, DHR helped launch the Rio One Health Network, a 2-county health information exchange that will allow collaborations between medical providers across multiple platforms and health systems.
All the money that is generated from a hospital usually gets sent off to Wall Street. Ours does not. Ours stays here.
In 2012, DHR had over 3,600 employees with a payroll of $170 million. That same year, the hospital also contributed over $66 million in charitable care. Doctors Hospital at Renaissance has an annual economic impact at $1.2 billion on the local community.
Having a Renaissance Hospital here with that many employees and a very nice philosophy of doing business and taking care of patients and their employees is very positive to our city, so we're very happy to have them.
And the good news is the type of jobs that are being provided by Doctors Hospital is in the range of $20+ an hour, which is a good wage.
When people are receiving their paycheck from a local hospital, the vendors are actually receiving the work locally. All of that money is recirculated into the community. That has been a huge boost for us.
And you can see it quite readily where people now, because of the tax base that's here, the money that gets generated through the employees, they are able to go provide for their families. Where everybody wins from this because they get to have a better life than their parents did.
My name is Nelda Nieto. I had woken up at about 5 o'clock in the morning on Sunday morning and I was experiencing a massive heart attack. And at that point, the company that I've been working for 17 years had just dropped our insurance, so I have no insurance.
I have a son named Jared. He was a year and 2 months when he got diagnosed with acute lymphoma leukemia, in simple words, cancer.
I was 7 months pregnant and getting close to my delivery date, a girl using her cell phone, she was on the cell phone, wasn't paying attention, we were at a complete stop and she just rammed right in the back of the car. They took me over to Women's Hospital at Renaissance.
They gave me top of the line care, or didn't care that I didn't have insurance.
Not only did they treat me, but they also helped put me at ease with what I was feeling, with all the emotions and the fear that I had.
As soon as I spoke with the social worker, she suggested, there's a charity program here at DHR. She said sometimes they'll take care of the total bill. And, I said, okay. And then 2 weeks later, she called me back and she goes, Ms. Gomez, we wrote off 10 accounts. And I started crying. I mean, to pay your medical bills, that meant a lot for us, And I was so excited, I couldn't believe it. I could not believe it that DHR had done that for us.
The triplets are doing wonderfully. They are healthy 2-year-olds. If they are just perfect, they're healthy.
I could have been in another hospital, might have not been here because they don't have what Doctors Renaissance has. The technology and people that go way out of their way.
We're about patients, that's the bottom line, period.
The only exclusive women's hospital in South Texas, DHR delivers over 800 babies per month.
All the babies that are born in South Texas now have a neonatal intensive care unit that can provide comprehensive state-of-the-art care.
The DHR Neonatal Intensive Care Unit, rated among the top 5% of the nation.
We have equipment now and a facility now that we didn't used to have in South Texas.
We are the leaders in advanced care and medical technology in South Texas.
We purchased the best equipment to be able to treat and help cure patients here at home.
As far as I'm concerned, this machine saved my life.
It's been a real dream for most physicians to be able to be part of this institution. We're making history.
Doctors Hospital at Renaissance, recipient of the Thomson Reuters Top 100 Hospitals 3 years in a row.
If you put physicians in charge and you create a facility that allows nurses to be nurses and doctors to be doctors, you can create and do some really wonderful things.
Here in the Valley, we're the trendsetter, we're the trailblazer, we're the hospital that's being innovative.
Because it's all about the patient, the community that you serve. And if you're true to the community will be true to you.
Physicians want to help people. They want to dedicate their lives to alleviating suffering and pain. A physician-owned hospital, that's a label. This is a hospital that is built for the community. This is a community hospital.
Doctors Hospital at Renaissance, a better healthcare model.